Athletes aren't the only ones at higher risk for concussions. A new study shows teens who drink alcohol or smoke pot have a 3 to 5 times higher risk of brain injury. The study, done by researchers in Canada, surveyed nearly 9,000 Ontario teens. The results revealed 1 in 5 suffered a brain injury at some time in their lives, 6% in the past year. But if you've witnessed someone who's had a few too many drinks, it shouldn't be too much of a surprise that intoxication and drug use can increase the risk of injury. However, the Calgary Herald points out researchers can't tell from the survey how the injuries happened, but booze and pot can make people dizzy and disoriented and alter their perception of distance and space. One of the study's lead authors talked to Canada's CTV.
There's no cause-effect relationship. But what this is to say, because it could be both. It could lead to traumatic brain injury, but it could also be the other way around. You resort to alcohol and cannabis as a way of coping with the injury.
Interestingly, the study also found a correlation between grades and risk for concussions, pointing out that kids who have poorer grades are seemingly at higher risk than those who have better grades. The researchers defined a concussion as a blow to the head that causes the victim to go unconscious for at least 5 minutes, a factor that could cause some transgressions in findings. As a co-director of the Methodist Concussion Center at the Methodist Hospital System in Houston notes, it's a common misconception that concussions typically knock people out. We know that about 90% of sports-related concussions do not cause a loss of consciousness, adding, it's hard to know how accurate the figures are because kids report their own history, and anytime studies rely on people's memories, that is a limitation. There are sometimes no symptoms with concussions, an injury that experts have called a silent epidemic, but the most common symptoms include headache, dizziness, nausea, and confusion. For Newsy, I'm Jasmine Bailey.